In today's episode, we're going to discuss the risk of venous thrombosis associated with oral contraceptive use. Enjoy.
The study's title is Use of Combined Oral Contraceptives and Risk of Venous Thromboembolism, Nested Case Control Studies Using the Q Research and CPRD Databases, published by Yana Vinogradova in the British Medical Journal in May 2015. I'd like to start this video with a question. What percentage of women worldwide do you think are on oral contraceptives? Is it 1%, 5%, 9%, 13%, or 18%? Any clue? Well, the correct answer is C, 9%. And what's the percentage in the developed world? Take another guess. You have the same options. Is it 1, 5, 9, 13, or 18%? Is it more or less than worldwide? Well, it has to be more, right? In fact, it's 18%. And what about the UK? Well, there, the number is even higher at 28%. Oral contraceptives, or OCs as they're also called, are the most common cause of venous thromboembolism, or VTE, in young women. The risk of VTE starts to rise 4 months after the initiation of OCs and returns to baseline 3 months after they're stopped. Most OCs are a combination of estrogen and progestins. Estrogen's prothrombotic effects are well established. The more estrogen is in the OC, the higher the risk of VTE. With progestin, that's a little more difficult because there are many different forms. It's generally thought that third-generation progestins are more prothrombotic than second-generation progestins. And that's exactly what Vinogradova and co-workers looked at, the effect of different progestins on the development of venous thrombosis. So they combined 2 large UK databases and created the largest study of its kind in the process. The study comprised of 10,562 patients with verified VTE and compared them to 42,034 age-matched controls who were free from VTE. They then looked at how many individuals in each group used oral contraceptives and which type of progestin was used. They found that overall, OC use was associated with an odds ratio of 2.97 for VTE, which was statistically significant. This means that VTE was almost 3 times as common in women on oral contraceptives. When they looked at the risk of individual progestins, they found that gestodine, drospirenone, cyproterone, and desogestrel were associated with the highest risk of developing VTE, with odds ratios of 3.64, 4.12, 4.27, and 4.28 respectively. Conversely, levonorgestrel, norgestimate, and norethisterone were associated with the lowest risks, with odds ratios of 2.38, 2.53, and 2.56. All of these odds ratios were statistically significant, which you can tell from looking at this forest plot. None of the 95% confidence intervals crossed the value of 1. And what does that mean in absolute terms? Well, for every 10,000 women who are treated per year with one of these drugs, 11 develop VTE in the gestodine group, 13 develop VTE in the drospirenone group, 14 in the cyproterone group, 14 in the desogestrel group, 6 in the levonorgestrel group, 6 in the norgestimate group, and 7 in the norethisterone group. Those are all pretty low numbers, meaning that the risk of VTE in young women who are otherwise healthy and fit is still pretty low, even when they're taking OCs. It should be noted, however, that this risk can increase by a factor of 4 in women who are over 39 years of age and by a factor of 10 in women who are obese. Taking these findings into account, it's highly advisable to prescribe compounds that are a low risk of VTE, especially in women whose risk of VTE is elevated even without OCs.
So I hope you enjoyed this video. As always, I'd be super interested to hear your thoughts in the comment section below. Also, if you want to download the infographic summarizing all the key facts covered in this video, then please download that below this video, or if you're watching this video on Facebook or YouTube, then go to mattmastery.com, go to our magazine, and download it right there. Also, if you want to get access to even more great teaching videos, then make sure to register for a trial account at medmastery.com, where you'll find all of our online courses and even more. So have fun, have a great day, and I hope to talk to you soon.